What can I do for it?
A good question. Do you find that there's anything that you do that makes this burping worse?
No. I'm very careful with the diet. I'm off chocolates. I'm off vinegars, tomatoes. I have a very strict diet.
Right.
And I'm careful about it.
Right.
No, once in a while, every couple of months, I'll get back into the GERD again.
Right. Well, I think sometimes you may need to add another medication to it. Sometimes we use 2 medications. Sometimes we use a medication in the morning and sometimes at night. Sometimes we switch up medications. Sometimes your physician will want to take a look into the esophagus and stomach to see why your treatment has not been complete or why it's being exacerbated. These are issues that somebody should look at and may try some simple changes of your medications, maybe some supplementation with vitamins, maybe some other things depending on what you're getting and what you're not taking. These are things that if you really look at the patient in a holistic way, sometimes you can get some answers. And if you can't get the answers, well, sometimes the physician will tell you at that point it's not dangerous and just do your best and you have to live with some of these things. But these are good questions, and, you know, you did have some surgery and that caused something, so it pays to speak to somebody in depth about it.
Thank you so much.
Okay, thank you. We're getting a lot of calls here. Let's go to Esther from Brooklyn on line 2. Esther, are you there?
Yes, hi. Thank you for taking my call. I'd like to ask you, I am suffering from H. pylori for the past few years. I've been taking these strong medications, and it was very hard for me to get rid of it. At one time, I did get rid of it, but I went for my second endoscopy, and it did come back.
Right.
The doctor told me to stop on the medications. So right now, I do have the H. pylori, and I don't know how to get rid of it.
Okay, let's first, you know, you're using terminology that people don't even understand what it is. Let's first go all the way back to the beginning thing. You said you had H. pylori. Well, H. pylori is a bacteria that lives in the stomach. It's a very unusual bacteria. It's a bacteria that does not live any other place in your body. It's a bacteria that does not cause pneumonia or skin infections or urinary tract infections. And it's a bacteria that only causes gastric problems. And the reason why H. pylori is now very prominent is because it's been recognized as a carcinogen, meaning that H. pylori may increase your chance for developing gastric cancer. So therefore, it's something that people now are very concerned about. It also causes gastritis and causes ulcers. And the treatment for H. pylori is antibiotics. And you know, the person who found the correlation between H. pylori and stomach ulcers won a Nobel Prize for it. And all his colleagues said, hey, we don't believe it. But the truth of the matter is H. pylori is now considered to be a serious infection of the stomach. And it is treated with antibiotics. However, it may not be cured in 85 to 95% of the people. To answer your question quickly, there is a second regimen and a third regimen involving other antibiotics and longer treatment of antibiotics. And if you look on some of the websites, there are also some alternative treatments for H. pylori, and you may use them in combination. Recently, a study just came out that showed that vitamin C added to the antibiotics will help treat the H. pylori, so you may try that. It's a very good question, and thank you.
Okay. 212-529-4620. Our number in the studio for Dr. Gettenberg is 212-529-4620. Dr. Gettenberg, I'm just going to interrupt all the callers with a question of my own. Is there a psychological component to, say, inflammatory bowel disease or colitis or what we use Crohn's disease, these intestinal ailments that make people's lives miserable? Is there a psychological component that says a nervous person perhaps or a stressed person might be more prone or bring these attacks as they were onto himself?
Wow, that's a great question. It also brings up another area which we specialize in inflammatory bowel disease. Before I get to that, let me just thank you, Alan, for asking me to come down tonight, because as I was on the plane last night and I was sleeping and I said I better get a few hours sleep, and all of a sudden there was a little turbulence and my children started to awake, and I got up and I said, wow, I better just think about what I'm speaking about. But here I'm very comfortable with you, and this is a wonderful show, and I thank you for inviting me on. But
Sure.
That's a great question. Inflammatory bowel disease, well, that's basically made up of two major conditions called Crohn's disease and ulcerative colitis. And these are very complicated diseases, but these are diseases where the body's immune system somehow is not functioning properly and attacks the intestines and other parts of the body themselves. And the issue is what came first, the chicken or the egg? Because if you have these these are diseases which make you go to the bathroom frequently, may cause pain, may not let you digest your food, may not grow properly, may have other complications. So therefore, what happens? Do you get nervous or stressed out because of the disease, or does the stress and anxiety cause the disease? Well, researchers now feel that stress and psychological issues do not cause inflammatory bowel disease, but they may cause a resurgence or a flare-up of the disease. We see that all the time. Patients who undergo physical and psychological stresses have flare-ups of these diseases. But it's a wonderful question, and really I have to tell you that the most amount of nerves in the body is in the gastrointestinal tract, more than even in the brain. So, and we all know what happens when we get nervous. We run to the bathroom, or we vomit, or we throw up. So really what happens is it's very hard to separate the two. And it's a wonderful question, and I do think that psychological conditions cause most gastrointestinal problems to exacerbate.
It's an incredible fact, though, that there are more nerve endings in our intestinal tract. And at the same time, we will remember that Chazal say that Choyle Mayin, the intestinal illnesses, are the most painful. Right. And it's clear as to why.
Well, you know, very interesting. I think it's in the end of Ksubis. There's a Shkafta, the Rebbe. He talks about Rebbe as he's passing from this world. A very interesting Gemara. And there it says that Rebbe suffered from a gastrointestinal disease. He had diarrhea and pain, and was such pain and such discomfort that he wanted to leave this world. And it's very interesting to think about it, because I see inflammatory bowel disease, and that very much sounds like inflammatory bowel disease. So here we have a Talmud, a tractate in the Talmud from 2,000 years ago, talking about some disease that very much sounds like inflammatory bowel disease. And as we know, inflammatory bowel disease has genetic connections, and it's at least 2 to 8 times higher in the Jewish Ashkenazic population.
That's going to be my next question, if there is a genetic component.
There is. We see through twin studies. I am blessed with identical twins, and it's one of the amazing things in life to see, but you can also learn things from them, and we see a very high concordance and a very high issue of genetics in inflammatory bowel disease. And although it's prevalent in every single society, in every race, there's inflammatory bowel disease, but it's 2 to 8 times, and maybe higher in certain populations, especially in Ashkenazic Jews. And some Jewish genetic websites will put inflammatory bowel disease, Crohn's disease, as a Jewish disease.
Interesting.
212-529-4620, 212-529-4620. Let us go to Five-ish from Flatbush. Five-ish.
Yes. Does brushing your teeth have an effect on the digestive system at night?
Well, I'm sure it has an effect on everybody else around you, but the teeth do have bacteria, and I think that it's well known that brushing your teeth, having a large amount of bacteria and plaque, may cause heart disease and other diseases. I know that people complain of halitosis, of bad breath, if they don't have proper oral hygiene. And I think oral hygiene is just an important thing in general. So I would say to you that it may not be specific for any one disease, but a lot of, you need your teeth to properly digest food.